Whoa, I'm falling.
Okay, Mimi, look what I found. Look here.
Energy, health. It's hard to tell who radiates more of it, 59-year-old Regina Stewart or her grandkids.
Okay, now you have to make room for me.
It's easy for Regina to kick back and enjoy life with her loved ones around. But a recent health scare that came out of the blue now has Regina taking a serious look at her lifestyle.
Totally out of nowhere. Never expected no other signs or symptoms ahead of time.
Regina showed up for work that morning at the First Baptist Church of Modesto.
Everything seemed to be fine, and then I walked into the door of my office and went over to my computer and set my things down, and all of a sudden I thought, I can't turn my computer on. And that was a weird feeling because I just had no idea what button to push or anything.
By lunchtime, the confusion escalated to outright dizziness.
So I got up and I went around the corner and down to the women's restroom, went to the restroom, and when I came out, I felt dizzy. And as I started to go down the hallway, I felt more dizzy.
Co-workers called her husband Lee.
And I could tell right away that, that something was a little different.
Lee took Regina straight to a doctor who sent her to the ER at Sutter Health's Memorial Medical Center, Modesto. Was she having a stroke? It was hard to tell.
I asked the emergency room doctor if he thought I'd had a stroke, or a TIA is what I called it, and he said, I don't think so. This doesn't have all the same symptoms. But he says you do need to follow up with your doctor.
Hey, hi.
Hi.
How are you doing today?
Doing just great.
Dr. Lisa Masson ordered more tests and found that Regina had high blood pressure, a risk factor for stroke. You see, stroke is a type of cardiovascular disease. A clot or blood vessel rupture cuts off the blood flow to the brain, which in turn can cause severe brain damage.
One of the things women need to know is that they are at risk. And a lot of women think, even today, that heart attack and stroke is a men's disease. Not true.
Women should be aware of the classic signs: slurred speech, muscle droop on one side of the face, and a massive headache. But sometimes the symptoms aren't that pronounced.
Women may have more subtle symptoms too. They may just have this vague sense of numbness, dizziness, nausea. I've heard women say just hiccups. I've had a patient present just with hiccups that turned out to be a cardiovascular event.
Dr. Masson says hiccups in a woman in her 50s with high blood pressure can be serious.
Migraines are another risk factor. People with migraines are more likely to have a stroke.
So, was it a stroke?
Well, the next day, one of my friends said that I even told her, I feel like I've had a stroke.
If it was a TIA, or so-called mini-stroke, it didn't show up on an MRI. But even though Regina didn't officially have a stroke, she's taking Dr. Masson's advice and trying to lower her risk for trouble in the future.
So if you get your life together, you stop smoking, you start exercising, you eat right, you're going to extend your life.
For Regina, that means taking medicine once a day to keep her blood pressure in check. She's also eating more fruits and vegetables, and Lee is paying even closer attention to possible warning signs.
The first thing I told her was, well, if you have any more of these spells, tell me about it. Don't keep it to yourself.
If there is something out there, maybe this is a way of catching it early enough, and I want to be healthy. That's my goal. I want to be as healthy as I can.